Hello, Kristen. My name is Rochelle. I'm going to be your physical therapist today. I just read in your chart that you are interested in increasing your breathing. By diaphragmatic breathing is what we're going to work on today. So, as your personal goal to work on breathing, what we're going to work on is this muscle right here called the diaphragm. So, when you breathe in, it's going to come down and flatten out. When you breathe out, it comes back up. So, I know you already watched the video at home on this, so you have a general idea of what's going on. But what I'm going to have you do when you lay down, you're going to place one hand here and one hand right here just by this bone between your ribs. And then my hands are going to go on top of yours. You're going to try to use this hand, breathe out first, and then this hand. So, like this. Okay? So if you want to go ahead and take off your shirt for me. Thank you. And then have a seat. Are you nice and comfortable?
Yes.
Okay, good. So place one hand on your chest for me, and one right there by that bone. Good. Alright, so what I have you do is push this bottom hand up first, and then you inhale, and then this hand up second. So you want to do both of them, but this one first.
Okay.
So go ahead and try. That time you did this hand first, so if you can go ahead and look down at your hands and try to do this one first. Right? Breathe in. Good. So we got your diaphragm going here, and next we want to go right here. So if you get this one. Okay. And just so you can feel this activate a little better, I'm going to have you do something called a sniff. So what you're going to do is go, and that should definitely get this going. So if you could look down, did you see that? Yeah. So if you could do that again, there you go. So that's what it feels like. So if you can get this going, and then do this here. Good. All right, let's do that 4 more times. Good. Inhale and exhale. Inhale and exhale. Very nice. So with Kristen, what we're going to be doing is blocked practice because it's a new skill for her, so we want her to get a hang of this before we move on to random practice with other diaphragmatic techniques. And then also we're going to do mass practice just because it's most beneficial for our time. And as you can see, I was using a fading frequency technique for feedback for her. So I started out giving a lot of feedback, and then I went to less feedback because she was getting better at it. And then also we would want to do practice the whole rather than parts of this because it's low organization, or it's highly organized and low complexity, so it's hard to split it up into parts. And now that we've waited about 5 minutes with no feedback on how she did, we're going to do a retention test to make sure she still remembers how to use her diaphragm to breathe. So, you know the skill we were practicing just a few minutes ago?
Yep.
I want to have you try to do that again. So, let's do 5 of them. Alright, so as you can see, she was activating her diaphragm first by making this hand come up first, and then this hand. So I would say that she has learned. And so today your therapy session is done, so I will have you come back in a couple of days and we'll work some more on your diaphragmatic breathing. So if you can do this at home for me, that'd be really good.
Okay.
Alright, so go ahead and sit up.